The opioid epidemic is a public health crisis that is affecting millions of lives every day. Over 130 Americans die daily from an opioid overdose, and the problem is only getting worse as time goes on. It costs the U.S. millions every year to treat and manage this epidemic. So, what are opioids? What are these trends that make the opioid epidemic such a problem? Opioids were originally drugs that came from the plant opium. They were then altered and manufactured into various drugs such as Oxycontin, Vicodin, and more. Synthetic opioids such as fentanyl and illegal opioids such as heroin now make up the majority of the problem. If you look at the graph here, you can see that all drug overdose deaths have been on the rise. Certain areas, especially poor and rural regions such as Appalachia, are particularly hard hit by drug overdoses. Opioid overdoses now make up the majority of drug overdoses, with over 49,000 of the 72,000 deaths in 2017 being due to opioids. The three kinds of opioids mentioned earlier, natural, synthetic, and illegal, made up the top three causes of overdose deaths in 2017. Studies had said these painkillers were safe, and they were made to help ease pains in serious circumstances such as surgery and trauma. So where did we go wrong? It's estimated that 3 out of 10 people prescribed opioids will misuse them. There was a staggering 58.5 opioid prescriptions written for every 100 Americans in 2017. This is down from 81.3 prescriptions for every 100 Americans in 2012. These negligent overprescribing practices leads to people becoming addicted to opioids, seeking dangerous ways to get more, such as faking illness, injury, or the purchase of illegal or fake opioids. In March of 2016, the CDC released a set of guidelines to try and promote safer prescribing practices for opioids. 46 states have since adopted this system, which allows for the tracking of patients' past and current opioid prescriptions. However, these changes take time, and prevention efforts are also being implemented to try and continue to slow the growth of this problem before it becomes even more of a national issue.